This is the Change Physician, episode 175.
So let's move back to the first one. So there's, I think, Name It and Tame It is kind of
Name It to Tame It. Yeah.
Yeah, because when I'm reading that there's Name It and Tame It and some of the alignment that's being promoted there, specificity necessary to ensure convergence of energy and clarity to avoid a misinterpretation. What I'm really hearing is defining.
Yeah.
That we're clearly defining and using words that have shared meaning and are narrow enough that we can define a specific action, deed, or whatever behavioral change.
Yeah, that will help us decide what's next, right? There's Liberating Structures has this framework of what, so what, now what. So the what is your observation, the so what is the implication, and then the now what is the action steps. And Kevin, I think you're right that Name It to Tame It means we need to add enough clarity and definition to the what so that there's meaningful so what's and now what's that might fall out of that.
Mm-hmm.
So I'll give you an example kind of into the realm of the business that we're in, right? Leading change in organizations. Resistance, right? Kind of something that everybody's experienced, like, oh, resistance, but there's not just resistance, right? It manifests itself in a lot of different ways. And so out of our research, we have 8 ways resistance manifests itself in an organization. Disengagement is the first, negativity is the second, avoidance is the third, emotionally is the fourth, work impact is the next, control, building barriers, and acting out. And each of those, we have all these like specific examples of what they mean. And so what are we going to do about resistance? That's too ambiguous of a what to get me any kind of meaningful so what's now what's. And so, yeah, Kevin, I think you're right. It's around that notion of definition. Hone it in. I call it, I have an acronym I created for this called P.O.P.I. P.O.P.I. It stands for Plane of Possible Interpretations. Right?
Mm-hmm.
So did you send the papers? Plane of possible interpretations is that big. Did you send the contract? Did you send the Acme contract? So when we communicate, we have the ability to deconfuse, right? To add clarity through reduction of that plane of possible interpretations.
Yeah, I mean, all of this is essentially communication, and it seems like it's a lot of hard work for people to get past emotions and resistance and all these things. So, I mean, I would obviously think that someone like your company would need to come in and help them, decipher those things. Kevin, did you want to dive any more in that Name It to Tame It, or do you want to move on to the other? I know there was like 6 or 5 others.
Yeah, we got a couple more. Do you want to run through those?
Yeah, well, Tim, so if Name It to Tame It was kind of where we started out, what's the next that we would say is most common or crucial that you kind of need to address?
Well, yeah, let's on Name It to Tame It. Let me circle back there because I think in the medical field, there's such a beautiful example of this. In the pediatrics office, you go into a pediatrician's office and they've got the pain scale.
Mm-hmm.
That cartoon pain scale? That's a Name It to Tame It mechanism. Because it is going to help the pediatrician and the child more effectively communicate about the level of pain that they're feeling, right? How it hurts is very different than a 6 on that scale of smiley face to, the one that's bright red and looks like it's ready to jump out the window. So the other neat thing about Name It to Tame It, especially when you go down this path, is if we can use something outside of the two of us to communicate about, then that gets even more effective. Because if you and I are trying to get aligned and we can actually look at something that's outside of the two of us, like that spectrum of 10 cartoon faces, the chance of us actually getting aligned goes up quite a bit.
Is that sort of you almost use like there's that outside measurement or outside device then provides an objective frame of reference. You can almost use it like a ruler, right?
Exactly.
You point to a ruler and you say, is it this big? Is it up to here or not? And now we both have this common frame of reference that we're using.
It's an anchor outside of us, right? Yeah, exactly. One of the other ones that we didn't touch on is called marathon measures, which goes right to this point, right? How long, a marathon is what? 26.2 miles.
Yeah.
I will never run one. right? I respect the heck out of the people that do, but that's not in my bailiwick at all. But we all know it's 26.2 miles. So if one of the people on my team sends me a report that they're writing, and I'm like, whoa, this is only like 10 miles down the path. I expected this to be at like 25 before you sent over to me. Or only take this one 5 miles down the path, send it to me and let me run with it from 5 to 20, and then I'll pass it back over to you to let you finish it out. Or wow, man, that was at 26.1. Well done on that first draft. I can't believe you brought it to 26.1 out of the gate. So we're using 26.2 miles as a measuring stick for doneness, right? Because talking about doneness more generally without a measurement that we can both anchor off of, this is because anytime there's a scale involved that we're talking about, things can get really dicey if we can end up on different places on that scale, right? I call this irrelative relativity. If we're talking about something that has relativity in it and we don't have the same anchors, we can end up thinking we're on the same page and ending up on completely different pages. So Angie calls me and says, Tim, go get a nice bottle of wine for this party we're going to. I drink $2 Chuck, right? Normally Trader Joe's $2 Chuck. So I walk out of the store with a nice $12 bottle of wine. And Angie just shakes her head when I walk in the door and says, that is not at all the caliber of wine we're going to be able to take to this party, right? She said, get a nice bottle. To me, that $12 bottle is a nice bottle. It's 6 of my regular bottles. But that was not nice in terms of where she needed it to be on that scale. So I bet y'all run into this quite a bit. Anytime we're using a relative communication that's along a scale, we need to make sure that people have the same anchors on that scale.
Yeah, I think there's a lot of people out in the online space that are essentially trying to create basically they're running businesses off of the specificity of the small steps. And it's not that the person that's receiving the information couldn't figure that out, but somehow we, for a lot of psychological reasons, we don't do the very things that we need to do in order to achieve change. But I think a lot of people are just packaging that same kind of approach for their own business.
There's a neat equation in the change space called the Gleicher formula that kind of gets at this a little bit. So it's D times V times F. So D times V times F has to be bigger than R. And R is resistance, whatever's holding us where we are today. So the D is dissatisfaction with the current state. The V is a vision of what's possible. And the F is first steps that might get me there. And this is Kathy Dana Miller's adaptation of Gleicher's original formula. But I like math, so I'm not sure I'm bought into the notion that it's an actual multiplication in there. But the neat thing about it being multiplying each of the variables is if any of those approach 0, what does the entire side of that equation approach 0? Yeah, right. So I can be completely dissatisfied with how things are, have a clear vision of what's possible, but if I don't see any first steps that are going to help me get there, I'm not going to get out of where I am today.
Yeah.
I can have a vision and have first steps, but if I'm not dissatisfied with what's going on today, I'm not going to begin to move either. And so it's a neat way to start to think about change and what's holding us in place.
Well, it's interesting. The first steps are really the inertia that you have to overcome for the resistance. I mean, it's essentially like those first steps is what kind of gets you over the hump to actually probably repeat, the change behavior.
But then even coming back and reframing this back into a more of a healthcare context, there's so much dissatisfaction in these communications that people have between doctors and patients with lack of action being taken place. And a lot of this, I would say, is, there's a lot of people who come into an office that are dissatisfied, and you may have sold them a vision of, well, if you'll be feeling better, you'll be on less medications or whatever. And then the lack would be those first steps. And I think that gets glossed over so much. Those specific first step kind of actions get missed in a lot of communication. To kind of bring it back to what Melissa was saying about a lot of people are building a lot on these real specific small steps. And we think, oh, those are so simple. Well, if you don't know them, they're not simple.
Yeah.
So,
yeah, and they also have community. They build community that helps, anchor, that social anchor and also witnessing how other people are doing it. Like it builds off of each other, those
Yeah.
first steps. Yeah. We don't do a great job in medicine as a whole doing that. But that's why health coaches have come into, I think, some of the realms of practices, because that's where that aspect probably is playing in to change. But that's
so Tim, I gotta ask this based on some of the context that you've been using in the conversation. For these particular alignment hacks, then the names like pivot with around purpose and matching manners and name it to tame it. Is this part of your institutional language then in your company? Like this, so this is like your shared language. So you can, because like Marathon Matters, you know, there's the hack where we can see what the point of reference that we need to use. But then if you were working with somebody and you actually mention, well, you're only at 15.2, they're going to know what that talks about because you have this shared alignment around this terminology of marathon measures.
Yeah, you start to get even quicker alignment because you have the shared foundation, the shared contextual anchors like we were talking about, right? So yeah, 26.2, the marathon one, shirt sizing, you know, we do a lot of small, medium, large, just a shirt size, as opposed to trying to get overly, you know, detailed early on. Solution lapse is one that we hadn't touched on, but that's one that is, you know, socialized language where, and it developed right out of the pandemic. And so I define a lap 1 solution as solving what's right in front of us. Lap 2 solution is stabilizing on that once we get it, or improving on that once we get it stabilized. And lap 3 is envisioning who we can become. Like that's the transformational lap. And so out of the pandemic, as we're responding to moving from being an in-person training business to having spun up a virtual training business, we had all these great ideas of things that we could do to better serve our clients and step out in front of this response. One of the very early ideas that came forward was weekend programs. Because when we were in in-person training program, we never delivered weekend programs. And all of a sudden people, you know, their calendars are being managed in a whole different way. I said, golly, that's a great idea, but there's no way we can launch weekend programs right as we're getting the problem in front of us dealt with. We're going to need to put this into lap 2. And so now we talk about internally, there's a lap 1, what we're tackling right now, and then there's a lap 2 bucket and a lap 3 bucket. And the neat thing, Kevin, is people will start to come forward with an idea and then they'll be like, well, you know, hold on, this is really a lap 3 idea. Let me make sure to put it there and document it there. But you have that shared framework that helps people get on the same page even quicker as well. And that's that context situation that we were talking about.
Yeah. I was, did you have something, Kevin?
Oh, go ahead.
Okay. No, I was looking at maybe picking from one of those other alignment hacks as to relating it to physicians. I was even trying to figure out how matching matters, how you'd relate that to maybe a physician patient. Actually had to look up. Go ahead.
The one I could see one on matching matters, right? Like as a patient, patients have different preferences for how and what kind of information they get on the way out, right? Like I know some folks who are going to want the 50-page, like they want access to all that information, whereas somebody else might want, give me, you know, three bullet points, less than 5 words per bullet point. And so that notion of matching the level of and the depth of information we're serving up to a particular client or customer or patient based on how they're wired and how they want to receive information, that might be one of those kind of matchings.
Yeah, I can see that actually in end of life care too, or depending on where people are on the age spectrum, right? So, because if you view everybody as the same, you may mismatch the therapeutic option for them. And so if you're in cancer and you may have somebody who's 82 years old, and maybe in that situation, we need to be very, very specific about what their quality of life measure is and how aggressive we want to be based on, so we need to match what their endpoint is and what the therapeutic outcome should be for them versus somebody who would be 38 years old. Because then if we don't have that matching, then we can end in situations where we're now providing inappropriate care and specific inappropriate care to the individual's wants and needs. So
nice, which I think Kevin ties into to what end, right? Which is
to what end? Yeah.
How is that person measuring success in this situation? Yeah.
Interesting. You know, I don't know if it relates, but I know that sometimes you can tell patients don't want to hear as much detail. It's like I've kind of figured out the level of describing what to expect with anesthesia and surgery. And you provide a video or you can do it in person, but you're taming. You don't want to it's all about anxiety and fear with that. So it's like taming it in a way where you feel as a clinician that you are informing them and that you're doing your due diligence, but you're not overly scaring them or annoying them and like, them not wanting all that information. So there's like this constant balance of that. I don't know if that would, I guess I'm trying to match what they want to know based on my experience of seeing them start wiggling in their chair, like you talked about earlier.
Well, and this comes back to him. I think this is important is then, so in your internal agency, you guys have these shared contextual anchors, right? So we have these words, but when you are working with another corporation or group, how then do you become aware when these alignments are not off or are mismatched? Like what are the cues that you use to see alignment mismatch when you're working with an unknown group?
Like if we are like matching matters, for example, I mean, we're talking live facilitation probably, right? Where you're spotting that it's not happening. So both Zoom and matching matters, like Molly, who introduced me to Zoom, would have a picture back on her wall of 4 Zoom levels of the same point on Google Maps, let's say, right? And she would just have it on the wall. And so in the midst of a conversation, when she starts to hear this group is talking at a country level and this group is talking at a state level, she would walk over and touch the Zoom frame. And then they would all start to recalibrate what that level of Zoom was. Same with matching matters. I have a colleague who will she has a picture on her wall of all 3 smiley faces, 2 dots in this line, some squiggles, and the Mona Lisa. And so she'll be in a conversation with somebody and say, okay, feels like we're trying to solve this with a Mona Lisa, but it might only need 2 dots and a squiggle. And so they started to use those as anchors. But yeah, Kevin, it's about spotting it in that moment of, wow, it just doesn't feel like we're on the same page when we're doing it, when we're spotting it. Now, if we step in, let's say we're stepping in and we want to we're supporting an organization who's intentionally bringing a change forward. Then we would bring something like Zoom forward in a very, very deliberate way. Say we're going to talk about integrated care, but first we're going to do it at a country level, at the country Zoom. That's just to give us a frame of reference. Then we're going to drop down to the state. Then we're going to drop down into 3 different cities. And so we would actually use Zoom as a frame to help, almost like those mall maps, right? Mm-hmm. Remember mall maps when it was like, you are here? Like that's a really important thing as somebody who's consuming information to understand where they are in the progression of the information they're about to get served up.
So in those, you're being proactive because before you're allowing that mismatch to occur, you're providing the mall map to say, well, here's the overview and here's where we are and here's the path that we're going to get to get there.
Absolutely.
I like that, the mall map. We just need they need a mall map for your patient visit, right? Where you are here.
Well, I bet you could make a mall map for a journey, right? A certain treatment journey that kind of starts to manifest.
I think depending on your specialty, I think it would be a lot easier. Mm-hmm. If you're a specialist, and if you're doing similar things over and over and over again, this would be an excellent space where you could sort of define that journey for them. A little more challenging in a general care sense, but yeah, interesting. You always make me think, Tim. You always make me think.
Well, I think that's what it's about, right? Like, how do we package and pass ideas to help move people forward? So yeah. Anytime we can take down those barriers, eliminate the rabbit holes people might get lost in, because we just spot that those are likely rabbit holes. So then let's put up those guardrails and rumble strips to keep the message moving forward.
So just to clarify off what Kevin was discussing, when you go into another organization that doesn't have the vernacular, the words and all these things you're using, you educate them on that before you start pointing that out?
Sometimes, other times it's just guerrilla, right? Like context and contrast is a huge one, right? That for a human being to make sense of anything, they need context. How does it relate to other stuff? And or contrast and context. How does it relate to the things around it?
Yeah.
And so we'll just almost, each time you're writing an email, say, you know what, do I think I'm bringing enough contrast to help people make sense of the message I'm trying to convey to them?
Mm.
Is this an opportunity where more context would help them make sense of the idea that I'm trying to pass them? So they almost become like filters that we look through as we're bringing change, as we're bringing communications, as we're building the ways we're engaging people in the organization.
Nice.
It's not only filters, they're contextual. The fascinating thing for communication for me is that so much of it was both the lens that we speak through, it's the filter through which we absorb, and then it becomes this shared context, this an anchor between communication. And they can be all of those things.
Oh yeah,
It's
for
like,
sure.
starts getting a little overwhelming as you're like, oh my God, this is so much more complicated than just speaking.
Well, and this is where I'm spending a lot of my time playing. And so maybe we'll dive deeper into this in another episode of this whole idea of there's the attributes of the idea that we're trying to pass.
Mm-hmm.
There's the attributes of the packaging of the idea that we're trying to pass. There's the attributes of the pass itself. So the moment of the pass of the idea. Then you have the context, the anchors and filters of the person who's going to reassemble it. And then the reassembled idea. Like, what did they make sense of it of? And so I'm starting to kind of look across that whole playing field to say, how can I more effectively package and pass? How can I more effectively understand context and anchors, anchors and filters, so that I can better contextualize? So,
Kevin, does this remind you of like that? Like we talk about all these perceptions and like that Feldman Barrett, I can't remember her first name.
Lisa.
Just how emotions are made. What was her first name?
Lisa Feldman Barrett.
Yeah, like there's a lot of this talking reminds me of a lot of that book. I don't know if it does for you.
Did you read that book?
I'll have to look it up.
How Emotions Are Made by Dr. Lisa Feldman Barrett, who's a neuroscientist, and she talks about how emotions are constructed. They're not, not something that are just inherent in you. But I think you will find it fascinating because this concept, that the idea of concepts and specifically categorization, that because of the how we learn things and we create this concept, then impacts all future learning. And it's these groups of concepts, which are categories or concepts, that actually heavily influence then how we perceive reality. But that's when we were talking about it earlier, it's like, oh my God, I just love this stuff. And the other thing that I love, Tim, I know we're running out of time here, but I just have to say, you said this early on, and I just have to bring it up again because it was so cool, was the Scotty beam me up. That we were trying to take an idea from your brain and stick it in somebody else's brain. And the ideal thing was if we had this transporter beam, but we don't. Instead, it's like this warped, and how warped the product ends up on the other side. It really depends on the fidelity of how we communicate effectively. So important.
And how many cycles it takes us to get on the same page, and that's all happening amongst everything else we're dealing with as human beings. Yeah. So this whole notion, this is what I'm most fascinated about, is how do we, because it's critical to get our most important ideas out there in as sometimes really quick and sometimes in as high fidelity as possible. So I've started playing with both speed and fidelity as the functions that we can adjust and touch impact when we start to communicate with a more empathetic tone. So
awesome. Well, Kevin, unless you have some other questions, I was going to ask him to share his info again.
I have so many questions, but we are running out of time.
Well, do you mind sharing where people can find you and what you're doing again?
Yeah, very good. So Prosci is the name of our organization. Prosci.com is going to be your front door into all kinds of resources to help you unlock the challenges of change. And then I'm most active on LinkedIn. So Tim Creasey on LinkedIn is where you get the bourbon inspired stuff. So that's a fun place to go. But it's all in the name of, if we treat our people right in times of change, they are more successful. The initiatives deliver the results we expect, and the organization grows this critical muscle to adapt to what's in front of us. So I really think it's important work and it delivers outcomes. So appreciate the opportunity to come share some more of it with you all.
Oh, well, thanks for joining us. And, I think it was nice to bring up the alignment hacks, but in the big picture for all this, like you said, you got to deal with the individuals that are part of the the culture or the organization to really create, effective change. So I thank you again for coming on the Change Physician podcast. I know we'll look forward to seeing you again. This is such a big topic that we don't put into words in our world of medicine a lot of times. So thank you again. And for those of you listening out there, this is the Change Physician podcast. If you want to know more about it, you can go to join the community at thechangephysician.com, whether you're a physician or a physician ally. We'd love to see you there, or any of the podcast venues where we share these episodes, and of course on YouTube for the video version, and join us on Instagram or the Facebook page, and our weekend Saturday or Sunday salutations to speak directly with you and each other. So thank you for joining us, and we'll see you in the next episode.
Stay well, folks.